My name is Maria Olofsson, and I work with innovation and tech startups every day. I'm absolutely sure that they can solve some of our future challenges in many different industries and areas. But for that to happen, we need collaboration. We need discussions that opens up to new ideas, solutions, opportunities, and sharing of experiences, of successes and failures. All that will help facilitate the leadership and culture to embrace these opportunities ahead, like we have done and discussed in many ways in this conference already. So I'm so excited to guide you through this session, where we will continue the discussions about some of the keywords that I found really interesting. So we were hearing user experience, trust, and that it's all about the people, safety, but also a possibility to reduce climate impact from distance spanning solutions in healthcare and care. The Stockholm Environment Institute highlighted this earlier today. So how will they be of importance for the Nordic digital healthcare and social care models of the future? So we are so thrilled here to introduce to you 5 of our Nordic ministers and 1 state secretary for health and social affairs to this next conversation. It will include integrated health and social care, the effect of COVID-19 and priorities of the future. So with us today, we have Eila Mäkipää, State Secretary from Finland. We have Lena Hallengren, Minister for Health and Social Affairs from Sweden. Astrid Krag, Minister for Social Affairs and Senior Citizens from Denmark. Bent Høie, Minister of Health and Care Services from Norway. Svandis Svavarsdottir, Minister of Health in Iceland. And Annette Holmberg Jansson, Minister of Health and Social Affairs in Åland. So let us start the conversation here now. So Finland has the current presidency of the Nordic Council of Ministers and has recently launched their priority product, achieving the world's smoothest cross-border mobility and daily life through digitalization. So first of all, I like to give a really warm welcome to the State Secretary of Finland, Eila Mäkipää. The digital stage is yours.
Thank you, Maria. I am glad to be participating in this discussion. The 3-year key project of Finland's 2021 presidency of the Nordic Council of Ministers aims to create a workable and permanent common model and practices for improving and increasing the effectiveness of cross-border data exchange and cooperation between authorities. The project's starting point are selected live events with focus on data and service packages relevant for everyday cross-border life and their interoperability. The live events in question are studying in another Nordic country, working or Baltic country, working in another Nordic or Baltic country, using health services in another Nordic or Baltic country, and finding information on legislation of another Nordic or Baltic country. The project starts with a baseline study with an aim to present current status and highlight possible obstacles for cross-border mobility and data exchange between authorities in regard to these live events. This is an important starting point as we want to develop a common operating model and practices. Healthcare-related live events are electronic patient summary and medical prescription. Both are important to secure healthcare continuity in cross-border situations. The project will place emphasis on aligning in its efforts in cross-border data exchange in Nordic and Baltic region with those carried out at the European level. Thank you.
Thank you so much, Eila. So let's move on to Sweden, and I will now invite the Swedish Minister for Health and Social Affairs to take the floor. This conversation forms a part of the final conference of healthcare and care through distance spanning. This project has been going on from 2018 to 2021, and it is a priority project by the Swedish government of their 2018 presidency program of the Nordic Council of Ministers. So Minister Hallengren, a warm welcome and the stage is yours.
Thank you so very much. I'd like to say thank you very much for including this panel discussion in the conference. The project Healthcare and Care Through Distance Spanning Solutions started, as you mentioned, during the Swedish presidency of the Nordic Council of Ministers in 2018. And today is the final conference for this project. And it's easy to see that it has had a lot achieved over the years. So let me name a few things I think is good with this project. Firstly, the cross-sectoral perspective of the project design is clear. A prerequisite for creating healthcare and social care for the future is to take social, economic, and environmental sustainability into account continuously. And in this way, we also contribute to meet the goals in the 2030 Agenda for Sustainable Development. Secondly, there is a clear focus on sparsely populated areas. It's important to find solutions which makes it possible for us to create access to welfare services throughout our countries and not just in places where many people live. Thirdly, the project is very concrete. This is clear in the publication of different distance solutions in the Nordic countries, and also the focus in the project on how implementation of these solutions is done in practice. I would also like to add that this project has aimed at achieving what has been very much on the agenda during the COVID-19 pandemic. Even though we have had an ongoing pandemic, we still need to make sure that patients with chronic diseases such as diabetes have access to their healthcare providers. I'm happy about the results achieved in this project, and I really look forward to a continued good cooperation in both the new project and the Finnish priority project on digitalization. I think it's a good example on how we can all benefit from the Nordic cooperation. So the discussion we have here today, I think it will be very interesting. I know we all have common challenges and interests in these areas, and I really look forward to hear what you all want to share in the panel discussion today. And I would also like to stress that even if this is a final conference, these issues will be on the agenda for a long time. I look forward to the next steps we can take together from a Nordic perspective. Thank you.
Thank you so much, Minister Hallengren. And I would like to continue this discussion to tour the table and start with you. And let's continue that VOPD has identified the potential of integrated healthcare and social care. So can you give us some more thoughts about the connectiveness of that and of the future?
Well, actually, I mean, we have a demographic challenge in all our countries with an aging population, and I think that that demands that we have an access to healthcare wherever we live in our countries, and we know that they are very differently. I mean, it's both more urban places, but also the more sparsely spread areas. So that is one really. I think we're gaining a lot when we have those kind of digitalization and good cooperation within the healthcare. And just to say that people in general, they are not that interested in who are deciding. They want to make sure that they get the healthcare they need. So the more we can focus on the individual instead of being limited with the body organizations, the better, I think.
Thank you. Really good thoughts. And let's move on the discussion, and feel free to raise your hand if you want to comment anything in this panel discussion. Moving on and toward this virtual table that I'm calling with this question. Minister Krag, what are your thoughts about the opportunities for integrated healthcare and care service options for the citizens in Denmark?
Thank you very much for the floor, and a big thanks to both Sweden and Finland for the presentations and the focus. Well, as Minister of Social Affairs and Senior Citizens, I will focus more on that than the healthcare part, even though I was at a point Minister for Healthcare. I'm now Minister of Social Affairs and Senior Citizens, so I will talk in that field. I think that increased digitalization of the social services has a great potential. We've definitely seen that during the COVID-19 pandemic and the lockdown situation, where the restrictions made it difficult to ensure the social service and support in the same way and manner as we used to do. And where we have never in Denmark had a digitalization strategy for the social field, we've always sort of capsulated that and said, well, these groups are too vulnerable. They're not ready for the digitalization. I think the COVID-19 pandemic and the restrictions showed us that this is wrong. And so now we are beginning a digitalization strategy specifically targeted to the social field. And I think that what my Swedish colleague addressed, the question about access, is very crucial here, because what we've seen is with a digital approach to some of the most vulnerable groups, we can actually ensure a greater access for them. This is both a geographic question, of course, as my Swedish colleague very much pointed out, but it's also a way of some of the most vulnerable, both patient groups, but also vulnerable groups in our society can access a help that really maybe on the paper was accessible for them before, but they had personal issues leaving their apartment and so on and so forth. And we've actually been able to support them very differently now, because we had to use the digitalization very much. We've seen the same in the care facilities for the elderly, where we've had, even though the family couldn't visit, we've seen much closer daily cooperation with the relatives and the families using digitalization. So I welcome very much the initiative from Finland, aiming to that we can help each other elaborate on this field. I think it's very welcome, and I think that the current pandemic has showed us a greater potential that at least we've realized in Denmark. Thank you.
Thank you so much, Minister Krag, and I totally agree. And if we have the time, we will continue to discuss the pandemic and how it actually has forced us to digitalize some parts quicker. Let's move on around the table with the same question for Norway. And Minister Høie, can you give us your thoughts, please, about the integrated healthcare and service options in Norway?
Thank you. I would say the Scandinavian country will in the near future face many of the same challenges. For example, there will be more people over 80 years with more complex diseases, and this will lead to greater demand for health and care services. And we cannot meet the demand only with an increase of personnel. And we are facing the same challenges and demands, but we also have, of course, see the same opportunities. Therefore, it is critical to rethink how we use our resources and deliver services. To keep our welfare state high quality in service, we have to find new working methods. And here, digitalization and welfare technology are important tools. Research and innovation are important to secure quality and affordable treatments in the future. So the Norwegian government has started to modernize the existing ICT system. We are now working towards solutions for the whole sector. This is a long-term work, and our vision is one patient, one journal. The patient should not need to repeat the same information to different personnel or do the same test twice. Information should follow the patient. And this work is also important for the ecosystem we want to achieve. It is a goal in Norway to move healthcare services closer to the patient with help of technology. We are working for a patient-centered health service that used to require patients who came to the hospital can now be provided with the help of technology, for example, by a video. So since established in 2013, our national program for welfare technology has worked toward integrating new technologies and services in the healthcare system. And so far, we see positive effects from the program. Welfare technology such as GPS have given elderly and people with disability more security and independence. To date, 304 municipalities have taken part in the program and 71% have started using the welfare technology program. And we also, of course, have tried telemedicine solution for patients with chronic diseases such as diabetes. And so far, we see the positive effect. And this strengthens our beliefs in use of technology in healthcare services. And we've also seen a reduction in hospital admission and outpatient consultation. And of course, during the pandemic, we have seen a high rate of use of these technologies to also solve a critical situation. Thank you.
Thank you so much, Minister Høie. And we heard some interesting stories from Agder in Norway, how they would use telemedicine and other really interesting technical solutions. So let's move on to Iceland and Minister Svavarsdottir. What are your input to this discussion about integrated healthcare? Can you please share?
First, thank you very much for the opportunity to be here with you and to take part in this very important discussion. Because the question is on the integrated healthcare and care service options. I mean, this integration between different systems in a way. The biggest challenge here is that the systems sort of don't talk together, because we have this a gap of information between those systems, between healthcare professionals also and social care workers, which of course leads often to lack of coordination and of the resources available to the citizens. And that is our main challenge in this field, really. Health data are available in nationally connected digital patient records and are by law accessible for health professionals caring for the individual, but social care workers are by law not allowed to access health records. So the system there is mostly paper-based and not available for healthcare professionals. So there is this lack of data sharing, which is sort of the biggest challenge. But I would like to mention in this context that the Minister of Social and Children's Affairs here in Iceland recently introduced a bill into the parliament that involves the integration of services for the benefit of children. And when this bill becomes law, it is expected that the information sharing will be more fluent and that the care coordination gap will diminish. Of course, I could mention different projects that we are working on to increase data sharing between healthcare and social care. For example, to help individuals that are victims to domestic violence, which has been a very important focus of the Icelandic system recently. But those are, of course, just the steps in the direction of filling the information gap between healthcare and social care. And we need supportive law and regulations, collaboration, and of course, digitalization and planning of the social care system and integration of those systems to share information and between the systems and then give better system for the public. So that is a lot of work ahead to close this gap, but we're working on it. Thank you.
Thank you so much, Minister Svavarsdottir. So I hear that we have some common challenges with data sharing. I heard from Norway, one patient, one journal, and I know in Sweden we're also working with this. So let's move on to last but not least in our virtual table, Annette Holmberg Johnson, Minister of Health and Social Affairs, Åland. Can you please share your thoughts?
Thank you, and thank you for an interesting conversation. And I'm so glad to be here, so I can gather all the good examples and all the thoughts that everyone else have. On Åland, even if we're a small place, we have a big archipelago, and we have 60 municipalities. And that's a challenging just that in these questions. But on Åland, we are working with these questions in 2 levels. In our social care legislation, we have required legally agreement with social and healthcare in different matters. And when we have 60 municipalities on Åland and a large archipelago, that is also one of the reasons why we also has to step up and be better in digitalizations. We have to continue with the legislation. We have to, for example, the legislation regarding information gathering, customer information, electronic archive law, everything that we not really have up to date. So we need to have that. But we also now is right now actually changing the, I think you say journalsystem, care info system for the hospital and for the social care. And we now have the goal that we should have the same on Åland, even for the private care provider and all the municipalities, that we should have the same system, because now we have different kinds, and the smallest municipality is around 100 people, but still, you know, we have to get everything to work together. So we have to have more smooth solutions, and we are working on it.
Thank you so much. And let's continue the discussion with you, Annette. And I'm curious to hear about, we have already been touching the pandemic, and the last year have, of course, put a lot of speed on the digitalization and accelerated the development and use of distance solution. So what is needed to continue this path so we don't fall back to business as usual? How do you do in Åland, and what have you done?
I think that we will never fall back, because it's been really an eye-opener. And we have nowadays, even the hospitals is more open-minded to use digital solutions. They have been quite conservative, but afraid to use new solutions. But now, when they have been forced to do it, they see all the possibilities and all the good things that you can do. In the social care, we have had something we call the äldreomsorg på distans. We have had like TV screens, television screens that we have put in the elderly home, and where they can have social, be part of social participations. They have had, games, music, dancing, where they're sitting and things like that. But also the social care have been using it, instead of driving long distance to give them a medicine in the evening, they have put the medicine somewhere in their home. They're calling them, and they are talking to each other over the screen. And they can, minimize the time they sit in the car, and they can talk to the elderly more. And that is a really good example. And so I think we will never fall back. We will step up, because we are far behind everyone else. So, but this has been a really eye-opener.
Thank you for sharing those interesting examples, and I'm interested to hear more about how the pandemic has affected us. And let's move back to Sweden, and Minister Lena Hallengren, can you share your thoughts about the pandemic and the acceleration, and how to continue in the future?
Absolutely, and I want to agree with my colleague from Åland that we will not fall back, we will step up. And I think it's important that we have that kind of mindset, really decide that we're going to use this opportunity. I mean, the crisis is a crisis in many ways, but we have the opportunity in a digital way, which is...
Man undrar vad han håller på med.
Det hörs, Sverige. My colleagues in Sweden are unmuted. But I think, let me say that it has been extremely challenging to cope with the pandemic and with the COVID-19, but I think that many things that we have learned, we are all common interested in trying to keep and also to I mean, we have to evaluate and see if it's done with the high quality, but we have to make sure that we want to expand it, because I think this is a way for professional and patients to have quite an easy way to have a communication. Of course, sometimes and quite often you need to have the physical meeting, but not always. And then it's also a possibility between professionals to have enough time and meetings. So we're trying to see it as structural reforms, and I think that I mean, the different distance solutions we have from Denmark, a situation, how can we use it in the elder care? I would say that we can see that the elder care is a women-dominated area. And we have less of technology, less digitalization than we have in the male-dominated industry. So I think we really have to use this opportunity, but at the same time, make sure that we evaluate, as I said, because we need to make sure that it's done with quality, that it's made with sustainability, but also the integrity is extremely important when you look upon, I mean, the elder people and also in the healthcare sector. Sharing data, I think it was Iceland mentioning that. I mean, that's extremely important that we have those values and try to keep them. And also, of course, the cost efficiency. That is, I think, almost all the time, it is very efficient when you come to the costs, but we have to look upon that. So we really have the aim to step up, to use this opportunity, not least in the elder care sector, but of course also in the healthcare sector, which is this project as we were also talking about.
Thank you so much. We heard earlier during the conference, and the VOPD has shown that there is a lot of studies showing that people can really put time into the important parts of their job. So feeling more meaningful by doing things that really matters, and maybe have less time in a car or transporting and so on. Thank you so much, Lena.
And just let me also say that, of course, I mean, we have patients. They are also in many areas in Sweden. You have maybe 20 miles to go, 200 kilometers to go to have this short meeting with the doctor or the specialist, and you can save a lot of time and make it a lot easier for the professionals, of course, but also for the patients. So I think that will give us also a good way to try to cope with this growing health debt, as we call it.
Yeah, the democracy of really opening up to all people. Thank you so much, Lena. And let's move on to Iceland with the same question, hearing about your thoughts about the pandemic and the acceleration and challenges and new things that might be of really good forcing the speed and the development.
Yes, thank you. I would like to tell you about several examples of successful innovation projects and new digital solutions that have been developed and implemented in healthcare in Iceland during the pandemic. First, we immediately developed a highly automated system for COVID-19 screening at our borders for all COVID-19 tests in the country. The system was up and running within 10 days from starting the project, and the system is fully integrated with our national digital health record, the national patient portal, and other databases, with real-time data flow via the Icelandic Health Net. Therefore, it has been possible for authorities to monitor very closely the spread of the virus and take precautions accordingly. And all individuals with positive tests are immediately contacted by the tracing team and ordered into isolation. So this has been very successful. New features have been added to the National Patient Portal during the pandemic. Also, I would like to tell you about the tracing app that was developed in that way that all citizens and foreign visitors are encouraged to download the app to help fight the spread of the virus. Travelers also received the test results via the app. So the app fulfills the requirements of the Data Protection Agency in Iceland, and a new version of the app via Bluetooth tracking will be launched soon. So this has also been very successful and a very good example of this, of projects like this. It has been, therefore, it's clear that it has been possible to detect symptoms, carry out tests, and track the virus via those solutions. It's also important to tell you about here the highly automated and integrated system that was originally made for COVID-19 screening and is now used for COVID-19 nationwide vaccination management. So it has now also been considered to adapt further to be used for cancer screening. So we can see ways to build on those projects. This is a good example of a very successful digital development and implementation in healthcare during the times of crisis. And during the pandemic, successful innovation of digital solutions in healthcare have accelerated at a tremendous speed. And it is also clear to me that citizens are in favor of increased digital health services, and they are using those digital services. So it's important to continue to build upon our digital health environment to improve public health services in support of better health outcomes for our citizens.
Thank you so much, Minister Svavarsdottir, for sharing those impressive examples. Maybe we can move on to Finland and the State Secretary, Eila. Please share us your thoughts about Finland and also about the pandemic, how you have accelerated the speed of digitalization, and if you have any examples you would like to share.
Thank you. In the future, we should show the value of technology and highlight how the technology has helped us to fulfill our goals during the pandemic. Emphasizing examples and user experiences will encourage us to continue employing new technologies. Human-centered design and user testing can help ensure that customers can access and use new technology. We should also enable employees to fully use new technology by providing them with training and resources. In summary, the lessons our government has learned about using technology and best practices to deliver services have to be analyzed carefully after this crisis. Thank you.
Thank you, Finland. Can we move on maybe to hear from Denmark? Minister Krag, can you please share your thoughts about the pandemic, how it may have accelerated, and of course, if there has been any challenges for Denmark?
Yes, thank you very much for that. It's very interesting what the crisis has showed us, and I think we've seen many very concrete examples of vulnerable citizens having very great use of digital solutions where we wouldn't have considered it earlier on. For example, young people with an anxiety actually being more able to receive education in the homeschooling where they could have extra support for their vulnerability, adults with an anxiety as well in the employment sector. We've seen great use with the homeless, developed an app together with the homeless organization in Denmark, helping them to find shelters when shelters were either closed or had fewer places for people to spend the night due to restrictions and so on and so forth. And I think one lesson that I take down as very important is that we shouldn't overcomplicate it. Lena Hallgren talked about this being cost efficient. And I think today almost every even homeless person has some sort of digital device to live the rest of his or her life. And so we shouldn't be so afraid to develop solutions from the public sector, from the healthcare sector, from the different support systems in the municipalities that build on the existing technology. We shouldn't build up great big new systems that we don't know if we can implement and that won't be cost efficient, but built on the fact that our societies, also when we look out in the world, the Nordic countries are very digitalized societies in total. So I think that's maybe the main takeaway point from at least the social area and the pandemic, that it doesn't have to be very complicated. Actually, the solutions are right there, and the vulnerable citizens, not everyone. We should always remember that there are those who are not digital, and they mustn't be left behind. But we can include this a lot more in our social service, and also diminish road time, as one of the colleagues told, with more time to the core support of the vulnerable citizens. But actually also when we look at the care facilities, the home for the elderly, the fact that healthcare has been more digitalized has also meant the fact that the most vulnerable elderly could have the contact made the everyday life more tranquil for everyone there. So even those not having digital contact with the healthcare system have also benefited from this. So I think I'm very encouraged by what we've learned, and I'm very glad to have this sharing of experiences, and I hope we can continue with that.
Thank you so much, Minister Krag. And I totally agree. There are a lot of solutions out there already. And we heard some examples during the conference earlier today, and also heard the phrase of technology optimism. So everyone is really already using different gadgets. So it's all about how to putting it all together and not reinvent the wheel. So we have Norway here again, but we have State Secretary Bjerke. So the question to you goes to, how about the pandemic? Yes, it has of course been challenging times, but it has accelerated the digitalization. Can you share some examples from Norway, please?
Thank you very much. Yes, the coronavirus pandemic has shown that the digitalization is very important. We also see a need for a better system, both locally and nationally. The lockdown has shown us the need for digital solutions in the healthcare services. With digital solutions, we were able to treat and also follow up patients during the pandemic, and also limiting the spread of the virus. For example, we have seen that doctors and patients quickly adapted to the situation. At the start of the pandemic, the proportion of e-consultations increased from about 5% to almost 60% in Norway. And also, we have seen that telemedicine solutions made it possible to follow up people with COVID-19 or people in quarantine. The feedback so far is that this has enabled good follow-up and has contributed to better continuity and quality in the health and care services. This also made it possible to maintain a minimal level of services during the pandemic. And also we have a survey conducted by the steering group for the Barents program in new technology and methods in 2020 that indicate that COVID-19 has led to an increase in the use of digital tools for health care in our region. And also in Norway, we experienced that all this was possible due to the existing national e-health solutions. For example, we could continue building on the Norwegian citizen portal called helsenorge.no, and also Kjernejournal, where the health personnel have access to important information about the patient. With this information, personnel can make the right decisions about treatment. Examples of concrete solutions are self-reporting of symptoms for the population, access to COVID-19 test results, and the contact tracing app called the Smittestopp, and also introduction of electronic death notification. So digital solutions will be the key to providing more effective health and care services for the patients. And also after the pandemic, we need to continue the good work with the use of digitalization as a natural part of how we deliver health and care services. And I hope every part of the health sector has seen the value of technology and also is motivated to keep using it.
Thank you so much, State Secretary Bjerke. And thank you for sharing your examples and numbers. And I think we have already been touching some of the final questions that I have for you. And I also know that we have a lot of interesting discussion in the next panel session that I will moderate. But let's move to really just briefly tour the virtual table to talk about the future. And we know that digital solution can bridge distance. What do you see as a priority during the next years to secure equal access to healthcare and care? If we look at for all age groups, remote, rural, and urban areas. So can we start maybe with Iceland this time, Minister Svavarsdottir? Just a brief thoughts about that.
Yes, you can. I think mainly we have to bear in mind 4 main points. The first one is the digital strategy in healthcare, which I think is very important that we have a strategy that can be our guidance for further digital development for the next years to come. Secondly, I think it's important for us to bear in mind the environmental and the climate aspect of this strategy, because traveling long distances is, of course, part of the problem we are solving in a way when we are focusing more on digital solutions. Thirdly, I would like to mention the human factor related to the education of implementing new technology for healthcare and care professionals, because more active patients should lead to better services. And fourthly, I would like to mention the financial models who have to support the option of providing digital healthcare service instead of the traditional service method. I would also like to mention that the analysis for Iceland in the VOPD project addressed that issue. And last but not least, I would like to thank for the cooperation with the Nordic countries addressing the local projects. We are very thankful for that. And hopefully we can carry on our partnership even after the formal project is over. Thank you.
Thank you so much, Minister Svavarsdottir. Thank you for your thoughts. And let's move on to Finland. State Secretary Ella Mäkipää, what are your thoughts about the future?
Thank you. Although the Nordic countries are performing well on many indicators related to health and well-being in an international comparison, there are gaps between regions, socioeconomic groups, and gender. Digitalization has the potential to overcome some of these gaps by improving accessibility to welfare services and thus well-being. Bridging digital devices is an important issue for Nordic governments to address. Otherwise, we run a risk of cementing persisting inequalities in the Nordic countries. Thank you.
Thank you so much, Ella, and thank you, Finland. Moving on to Denmark, I'm speeding up here the last round. Minister Astrid Krag, are you with us? I can see the picture, so I'm moving quickly on to Sweden and Minister Lena Hallengren. What are your thoughts about the future?
Oh, well, thank you. I think it's important to say that some people feel, they have fear when we talk about the digital solutions. We talk about the elder care, for example. Are we going to replace the human resources and the professions with technical solutions? That is something we have to face. I think it's important that we really have, the day-to-day care, the primary care, we have to focus on that, because if you make that very accessible, that will help the whole chain within the healthcare. And finally, I think it's important that we really make sure that we have universal solutions, that we think about what you said before. It has to be accessible for everyone, and everyone is not familiar with the digital solutions, and we have to consider that, because otherwise the digital solutions will not increase the accessibility, maybe the contrary. So I think that's important to be aware of and to really work with that, because I think the digital solutions they are here to stay in the future.
Yes, thank you so much, Minister Hallengren. Moving on to Åland and Minister Annette Holmberg Jansson, what are your thoughts about priorities in the future?
The challenges is the access to all users, persons with different disabilities, and elderly is important matters to coordinate so they will get all the help they will need. We have a big civil society, third sector, that we support financially for their supporting work and how to learn elderly how to use the computers and iPads. And we have had a question, what can we do and what can we find in all these 16 municipalities that is, we can find somewhere where they can go and get help, and if we can have a computer where they can go and so on. And we've thought of churches. There is a church in every municipality. There is a library in every municipality, and also different kinds of civil society groups. So we have to be better to use also them to help us with this work, because they want to help. And I stop there because you have short of time.
Thank you so much for participating and sharing your thoughts, Åland. Moving on, last but not least, to Norway and State Secretary Bjerke. Can you please share us your thoughts about priorities in the future?
Yes, thank you very much. First of all, we see a need for increased coordination between systems. We see many patients receive treatment from both local and regional level, involving different professions, and also this creates a need for coordination and sharing of information. The systems for sharing relevant information must be interconnected so patients experience coordinated services. In Norway, we see that the current systems don't use the sector resources well enough. The patient's information is often spread across systems, and life important information is not always available in critical situations. Also, lack of access to information can lead to inequality in health, as it leaves a lot of responsibility to the patients who has to carry relevant information. Also, it can lead to incorrect treatment and patient injury. Digital solutions also represent an opportunity to decentralize the specialist healthcare service and thereby increase access to services across rural and urban areas. In Norway also, it is a goal that the national e-health solutions are implemented and used by the entire healthcare system. As of now, we see that the solutions are mostly being used in the specialized healthcare services by the GPs, the emergency services, and pharmacies. However, the national e-health solutions are not in the extensive use locally in primary health and care services. Norway is a geographically large country with great distances. We have 356 municipalities with self-government, and today most of them have different systems in the healthcare and care services that are not compatible and therefore cannot exchange information. This is a challenge. And also see the need for innovation and collaboration with the private sector. Cooperation between public and private sector is also necessary for digital health to succeed. If we are to succeed in developing a sustainable health and care services, there must be new and more innovative and efficient ways. of providing health and care services. To achieve this, technology and digital transformation are often a prerequisite. So I believe that the Nordic Council of Ministers has a role to play here. The close collaboration within our Nordic family is a good platform for discussing how to develop and implement digital solutions that are tailored to the conditions in our region, with the aim of securing equal and better access to health care and care services for the population. Thank you.
Thank you so much, Norway. And thank you all for being a part of this panel discussion. We are so grateful that you are sharing your thoughts, and we could hear about collaboration, and there are a lot of solutions out there. And if we just share, we don't have to reinvent the wheel again, and we can just create the future together. So thank you so much for sharing.